Hello, good day everyone. Welcome. You're watching Liberate Yourself from Chronic Pain with yours truly, Stephen Simon. I hope everyone is doing well and feeling great, having a wonderful day. Today I would like to talk to you guys about communicating to your doctor about your medication. Okay, so I'm keeping up the theme with the medications, things that you should ask your doctor, things you should tell your doctor, and yep, that's it. So let's get going. It's really a teamwork. It's really a teamwork between you and your doctor that things work out. So that's why this is important to talk about. Okay. Now, as a self manager, you need to know about your medications in order to successfully manage them, right? Okay, so your body even responds differently to any one medication that you take, and it can depend on a few different variables. It can depend on your age, your metabolism, the stuff that like your daily activities, your chronic condition, your genetics, and I even believe it depends on your frame of mind as well. Okay, so to make sure that you get the most of your medications, your doctor depends on you. All right, so and what I mean by that is that when you see your doctor, you should report these things back to your doctor, like, report, what type of effect that the drug, your medication had on you. Okay, so it's critical for your doctor to know basically if there was any symptoms, any side effects, so that they can whether decide to continue giving you that medication, whether they need to increase the medication if it's not helping you, whether to discontinue giving you the medication also if it's not helping you, if you're having side effects to that, and they may even need to change it altogether, right? So you need to relay this information to your doctor on how your medications make you feel. Okay, now so it's a partnership. Okay, it's a partnership between the doctor and the patient and the doctor. Okay, so and in a partnership slash relationship, you need to communicate together. So the doctor's job is to communicate when he's prescribing you the medication on how to take it and what it will do for you. And your job as a self-manager is to ask questions and tell your doctor things. So you want to ask questions about the medication, which I'll get more into. But right now, I'm going to talk about things that you want to tell your doctor as well. Okay, so now, unfortunately, this type of communication is often neglected. Like, people don't really ask questions, and doctors don't probe enough for you to tell them information. I think even on a revisit, on a follow-up, that's the word I'm looking for. On a follow-up, sometimes they still don't ask enough questions, right? So, honey, what are you doing? Sorry, Honey's distracting me. Honey is my dog. So, yes, unfortunately, this communication is sometimes neglected. Okay, now very few people ask questions when it comes to getting new prescriptions, and because they don't ask questions, the doctors tend to interpret silence as understanding what the medications will do for them, how they will react, how they will feel. Okay, so don't be afraid to ask questions. Asking questions is necessary, part of a healthy partnership with your healthcare provider. Okay, so 4 things that you want to tell your healthcare provider. Number 1, you want to tell them if you're taking any other medications than the ones that they are prescribing you. Okay, so sometimes you may get stuff from another doctor, or anything, or over the counter stuff. So you want to tell your doctor what you are taking. Make a list of all the prescriptions and non-prescription medications that you're taking. If you're a woman, if you're taking any special like birth control pills, any special vitamins for maternity, any type of herbal remedies, any laxatives, any alcohol, any cannabis. You want to tell your doctor these type of things. Okay. Now, you also want to maintain an updated list of all your medications, along with the amounts that you're taking. The dosage that you are taking is important for your doctor to know as well. Okay, so you can bring all your medications with you. I usually carry mine in a little baggie like this. So if I'm traveling anywhere, it makes it easy for me to carry and bring to a doctor's appointment or an overnight wherever I may go or something like that. Okay. Now, if you ever go to more than one physician, I've had this happen several times. I'm sure you guys have as well. Is that if you go to more than one physician, they always ask you what medications or a list of medications that you may be taking, because each healthcare provider may not know what the others have prescribed to you. Okay, so it's important that you tell every doctor that you see or provide a list of your medications to every doctor that you see as well. Okay, so your healthcare provider, as I said, they may not know all your medications and they cannot protect you from any drug interactions. Okay, I remember I spoke about drug interactions in my last video, and that's when you have multiple drugs and one may react different than the other one and may not cause it to work effectively. Okay, so you don't want any drug reactions. You always want to tell your doctor what you're taking. Okay, so number one was tell your healthcare provider if you're taking any other medications. Number two, tell your healthcare provider if you had any allergic reactions or any unusual reactions to any type of medications that you are prescribed. Okay, so you want to describe your symptoms and unusual reactions, caused from any of the medications that you're taking. If you know which medication is causing that reaction, then discontinue it and report it to your doctor immediately. Okay, I want to tell you a story. For the last 3 years, every summer, for some reason, my feet have been swelling like really bad. If you ever seen a pregnant woman's foot when she's due for labor and her feet swells, that's exactly how my feet have been for the last 3 summers. I don't know why or what's causing it. It only happens in the summertime. The first time I did start a new medication maybe a month or two prior to the summer months, and I reported it to my doctor. I don't think that's what caused it, but when something like that happens, you got to report it immediately. Even if you're fine, even if you're feeling fine, it may not be paining you, you still want to report it. Okay, so you also want to report to your doctor any side effects that you excuse me, from any medication. Side effects may be like nausea, diarrhea, sleepiness, drowsiness, itchiness. I get itchiness a lot from I think it's my pain medication. My what am I on? Suboxone is my pain medication right now. But anytime I'm on like even any oxys or morphine or anything, it still gets itchy. So for some reason those things make me itchy. If they make you itchy, any medication that you're taking, you have any side effects, feel free to leave it in the comment section. Let us know what medications you take that make you itchy, or what kind of side effects you're having with your medications. Okay, so leave a note in the comment section, give this video a like and thumbs up, And also feel free to share this video. Okay, now, so there's two more that I want to talk about. The other two is you also want to tell your healthcare provider, what other medications besides your chronic pain medication that you have. Okay, so, if you have any other diseases, for example, like, diseases involving like your kidneys or your liver, that's really important to mention, because they can slow down your metabolism, and many drugs often increase toxic effects to your health. So you want to tell your healthcare provider, and you also want to avoid, your healthcare provider may want to avoid prescribing certain drugs to you if you have like high blood pressure, if you have diabetes, if you have asthma, if you have like prostate problems or anything, like any type of ulcer disease. Your doctor wants to avoid prescribing certain medications to you. So it's very important that you tell your doctor what other what other medical conditions that you have besides your chronic pain. Okay, so number 4 is that you want to tell your healthcare provider what medications you've also tried in the past. Okay, believe it or not, it's a good idea to keep a record of your medications that you've taken in the past and that you're currently prescribed. Okay, and knowing what has been tried in the past and reacted well for you is good notes to have. Okay, you also want to know if you've had any negative reactions to certain medications in the past that you want to you want to relate that information to your healthcare provider as well. Okay, so however, keep in mind also that just because you've taken a medication or it wasn't effective in the past doesn't necessarily mean it can't or shouldn't be tried again in the future either. Okay, chronic pain and other diseases, sometimes they change and the medication may work a second time. Okay, I used to be allergic to something that I used to be allergic to. Codeine. I used to be allergic to codeine. Not really allergic, but it made me hallucinate as a child. I remember I was like 10 years old or something, and I know codeine used to really make me hallucinate. But now if I take codeine, I usually only get it when I'm in emergency, but if I take codeine now, I usually don't have any side effects. So, that's an example of things that, may have gone wrong in the past that I can take now. If you guys have any other medications similar to that sort where, you've had a reaction in the past and now you are okay taking it, feel free to leave that in the comments as well. I'd really like to hear your stories, your successes about your medications as well. Okay, so that's all for today. Thank you for watching. I appreciate it. I love you guys. I have the best audience. You guys are awesome. So thank you for watching. I love you. Have a great day. And how do I want to end this? I'll just say I love you. Thank you. Bye.